If the beam from this angle, for example, and the beam see bladder or rectum, that area is blocked, only treat prostate. If go from another angle and see little bit of small bowel, that area would blocked, only treat radiation. You modulate the beam. So the area see prostate, treat, go ahead. The area see not prostate is blocked or attenuated. How that happen? In the head of the machine, there is leaves, lead leaves, shield the undesired radiation. See how sophisticated it is? We call it intensity modulation radiation. And they usually 5 or 6 or even 9 angles where you focus into the prostate. And that's a good treatment, and that's one option. And many patients just come for about 8 weeks, stay a few minutes every day until Monday through Friday, 5 times a week, about 41 treatment, or 43 if they have more aggressive cancer. We call this external beam intensity modulated radiation therapy. We tuned that area a little bit in the past few years because prostate moves up and down. And if the bladder is full, the prostate move little up. If there is gas in the rectum, the prostate move pushed anterior, and so on. So how we overcome this problem? We overcome this problem by quickly, prior to the treatment, we do what we call it ultrasound or image guided radiotherapy, IGRT. You're going to hear this all the time, IGRT, image guided radiotherapy. You every day take a couple of minutes to scan the prostate, and you already have a system there. You have the first day the patient picture on the CAT scan, and you align those together. If the prostate moved a little bit, you adjust the patient to match the original picture. So you stay in the same day, and that's how the new technology. So you do IMRT, intensity modulation radiation therapy, supplemented by tuning, which is IGRT, image guided radiotherapy, to make sure you are treating the same area every day. If the prostate up, you move everything to follow the prostate. If the prostate move left, you move everything based on this quick ultrasound. We do it 2 minutes. It takes 2 minutes before daily treatment. And that's the state of the art. 10 years ago, we didn't have such technology, but today we do. And now, you need to understand, if you have a spider, all of you seen the spider, you could give radiation to the legs of the spider and spare in between. See how sophisticated the radiation today is. Thanks to the technology, thanks to everything, make it so easy for patients. Patients do not get those side effects we used to see 20 years ago, burning in the rectum, burning in the bladder. They get minimum, if any, side effects with this technology. Why is that? Because you focus your radiation into the desired area. So the normal area does not or get less radiation. Radiation should not cause significant problems. So that's one option of radiation, IMRT, IGRT, intensity modulation radiation, image guided radiotherapy. What are the second options? For those patients with intermediate risk, we classify patients of prostate cancer to 3 risks: low risk, intermediate risk, and high risk. Low risk could go with radiation, as I mentioned before, external beam, intensity modulation radiation, or seed implant, or what we call it high dose rate brachytherapy. I'll explain it in a second. So for low risk patient, they get either external BM41 treatment or seed implant, where the seed is implanted into the prostate permanently. Small seeds, each seed measure about ½ millimeter in diameter, 4 millimeter in length. It's very tiny, it's like a tiny needle, really, 4 millimeter in length. And usually between 50 to 150 seeds, radioactive seeds, inserted into the prostate, depending on the size of the prostate. For small prostate, about 50. For very large prostate, about 150. And about 100, those cases in between. What happens is the prostate is measured by ultrasound, and the exact dimensions of the prostate pictured and recorded. This will go to the computer, and the computer aided dosimetry, or the plan is done to decide on how many seeds will be in the prostate. And the radiation oncologist, the radiation physicist, carefully examine those location of the seeds in relation to the prostate to make sure you get the right dose to the desired area. Once the plan is done, then the patient come to an operating room where they get light anesthesia, enough to get the process, which about ½ an hour or so. The ultrasound probe is put in the rectum to see the prostate, and the image, there is a screen, you could see it on the right side of the patient. Then through a template, needles are put in the space between the scrotum and the anus. There is a space, look like that. That's where the needles are put through that space to the prostate, and according to the plan, you deposit those seeds. The prostate about 4 or 5 centimeter in length, so you put seeds along, usually 15, 10, sometimes 8 needles, depending on the size of the prostate, and each needle has 5 to 6 seed, 1 centimeter apart. Those are deposited into the prostate permanently. After that, the patient go home same day and do normal activity, and within 1 to 2 days, and is not a problem whatsoever. This seed implant was done in Flint about 10-12 years ago, probably 12 years ago. That process is good process. Minor things could happen. Seeds could move in the prostate, even though in 90% of times it's okay, but in about 5 to 10% there is about some minor variation of the dose. The seeds might move a little bit for whatever reason. Sometimes these seeds are in a blood vessel, so they could just shift. Sometimes they shift a few centimeters, sometimes a few millimeters, and so on. Few seeds, of course, not all of them, just a few. And what happened after 1 month, some prostate nodule grow in the prostate, and that could shift those seeds right and left. Even though those seeds give radiation, in case of I-125, this is a type of seed, the half-life about 2 months, meaning after 2 months is 50% of radiation gone and 50% stay. After another 2 months, 50% of the 50%, that's 25%. Then of those 25, 12.5%, 6.25%, and so on. We call it exponential decay. Each decay, that's the radiation to the prostate. So after a year or so, minimum, if any, radiation is in the prostate from those seeds. I'm talking about the seeds, the minimum radioactivity.